Dr. Leaf, you've been at this for a very, very long time, and I'm wondering what makes you think right now is different. What creates this as a point in time that you're feeling so hopeful about?
Well, it's a good question, Deborah. I think there are several things. One is, you know, when the Institute of Medicine report came out, we all could see it was the thing to do, but we didn't really know how to do it. And in the intervening 10 years or so, we've developed a tremendous armamentarium. We have a lot of tools now. We have a lot of safe practices. We know a lot more about how to prevent infections, how to prevent medication errors. So we've got the tools in hand. And at the same time, I think everybody in healthcare has seen some successes. They've seen some things that work, and they realize that they can do a lot more. So I really have the feeling we're poised on the edge of a significant acceleration in our rate of improvement. Healthcare is incredibly complicated, and it gets worse every day, it seems. And so every new treatment, every new device, every new medication has its own potential for errors. And so we have a constant challenge, but I've never seen anything like the kind of engagement we now have. I think healthcare workers everywhere realize the problem's serious, and for the first time they can see some ways in which they can do something about it. So I really think we're going to see a lot of improvement in the next 5 years.
Great, thank you. Moderator, do we have any questions?
We do. We'll take our first question from Bill Brown.
Hi, I'm wondering where I can find out if my local hospital has already signed the pledge.
Okay. Yes, you can either go to the Campaign for Better Care website, which will direct you to the Government Partnership for Patients website, or you can go directly to the Partnership for Patients website, and that is at www.healthcare.gov/center/program/partnership.
Thank you.
Sure, and we will have this all posted on our website. Great, thank you. Are there other questions?
And we do have another question in the queue from Leo Suello.
Okay, Leo?
Hi, this is Leonardo Cuello from the National Health Law Program and the Campaign for Better Care. And my question is, for other people out there who are on the call out in the state or helping people out in states, how do they learn about these sort of new models that are a better way to improve care, and how do they start working to have those implemented in their state? What steps can they take?
Well, one of the places that folks can go is to the Innovation Center at the Department of Health and Human Services, and that information also is on our website, Leo, but there you will find a whole list of innovative resources, programs that are available. In addition, you can also go to the AHRQ website for information and tools. Carolyn, do you want to say how to reach that website?
Yes, so it's AHRQ, Apple, Harry, Queen, Run, .gov, and right on the front page there is a button for consumer information. And you will see information about podcasts if you're someone who learns by listening, and also information about tips for, say, using medicine safely, taking care of myself, a guide when I leave the hospital, and many, many more.
Another thing that I would add in here is that Dr. Clancy mentioned that today there was announced a $500 million program that's going to support hospitals in doing innovative things to improve the safety of care. But there's also another grant program that has been launched by the Innovation Center that is designed to help community-based organizations get involved with their hospitals in addressing the question of transitions of care and readmissions. And there's also a website you can go to get information about how to apply, what's required, how to apply for that kind of a grant. And you can go to the Campaign for Better Care website and find the very long URL for that. I won't try to read it on the phone, but we have a fact sheet called Community-Based Care Transitions Program, and you can directly get to the application guidelines from that. There's also a press release on the general HHS website that has information about where you can go to get the actual guidelines.
hhs.gov, G-O-V.
I also would like to say that for any state legislators or staff who would like assistance in getting involved in their communities, who would like to get connected with consumer groups in their communities, we would be very happy to work with you, and I would urge you to call us here at 202-986-2600 and ask for Courtney Shahan, S-H-A-H-A-N, or go to the info@campaignforbettercare.org email that you see on the screen right now, or to the website. But we would be very pleased to work with all of you individually if you would like help in getting started or reaching out to folks in your community. Moderator, do we have any other questions?
We have no further questions in the queue at this time.
Okay. Do we have any other questions here in the room? Carolyn, I'm just going to ask you one last question.
Sure.
And that is similar to what I asked Dr. Leap. This is a unique time right now in terms of many factors converging to make this possible. I know there's a lot of excitement within the agency and different kinds of work going on. As you travel around and you talk to providers about this program, what kind of a reaction are you getting, and what's your sense of whether or not there's any penetration of this excitement?
I think the penetration is very significant. First of all, many places I go to, people know about the campaign. Some of them are leading edge, some of them are just hearing about it, but I think Dr. Leap would agree that, you know, when the Institute of Medicine report first came out, there was a lot of debate about the number of people who died from medical harms. Now, numbers are good to debate, and it's always good to debate science, but it kind of missed the overarching point, was that any number greater than 0 was too high. I haven't heard someone make noise about the numbers for several years. And I'll also say that once people get the bug and start, and I don't mean one of those bugs, killer bugs, I mean get the excitement, because it is infectious, about making change. You know, if you ever meet anyone from Michigan who was part of the original Keystone Project, well, they're ready to take on world hunger, peace, you know, big issues, because it's incredibly empowering. So part of the reason I think it's ready now is just because of all the work that's been going on in recent years. You know, bad news always seems to go viral and controversial stuff really fast. Solutions are different, but at the end of the day, I always come back to something a leader in critical care medicine said to me several years ago. He said, you know, we always knew about the infections in ICUs. And he didn't say it this directly, but pretty much between the lines was, we just thought they were inevitable. And he said, those results changed our ideas of what's possible. And there is nothing more exciting and empowering to healthcare professionals and organizations writ large than that idea, that you can do dramatically better. You can't buy it, you can't pay for it. It's just very, very empowering.
Well, that's a really nice story to share, Carolyn, and I think there is actually a companion story on the patient side of that, because when we first went out to talk to patients about these issues, we found that, we'd ask them about safety and quality, and they'd say, no, it's not a high priority for us. And as we began to dig deeper, it became clear it wasn't because they hadn't experienced errors or they didn't know family members who had it. It wasn't because they didn't have problems in getting the care that they needed. It was because they thought, well, this is just the way the system is. And they didn't have any idea that it could be different. And they had no picture of what different could look like.
Right.
And when we started talking about some of these models where people are really at the center of care and getting coordinated care, the light bulbs went off and folks said, sign me up. I want to be a part of this. So anyway, it's sort of an encouraging compliment of both the provider and the patient inspiring each other. Any other? Kirsten Sloan?
Deborah, you and Dr. Clancy and Dr. Leap all talked about the impact on patients of this effort, but for state legislators and their staffs on the phone, there's also an impact on the cost of care as well. I was wondering if you all would touch on that slightly.
So from the federal side, the same financial incentives will be applied for the federal portion of Medicaid. I believe that in some states, the states have stepped up to do it for their state Medicaid programs. But I think it's something that bears a serious look-see, because this is a win-win. Better care and lower costs, wow, hard to beat that combination. There just isn't a lot you're going to find with the challenges facing states these days that really comes up to that level of potential.
And wouldn't you say that in some ways states can take some of this stuff even further and be very, very creative about how they go about it?
Oh, absolutely. I mean, one of the things I think Deborah and Dr. Leap and I and many others have learned is just as we know that all healthcare policy is an interesting intersection and mix of federal and state policies, there's always some states that are out on the leading edge. And what I find most fascinating, because I know that people from across the country have signed up to be part of this today, is that no state is doing everything right. Almost every state has areas where they are hitting it out of the park, and other areas, I'll just say not so much, where they can learn from other states. So I think there's huge opportunities, and I think the learning here, how'd you do that? I know it excites clinicians and hospital leaders and so forth, and I would think that it would excite legislators as well.